better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Hi, everyone. I'm Dr. Liz Turner of Untethered Airway Health Center. I wanted to take some time today to walk you through your child's jaw growth and development and how it impacts not only their airway health, but their overall health and sleep quality. So let's get started. Again, I'm Dr. Turner. This is Dr. Hannah Kessler and Dr. Megan Kack. We specialize in helping infants, children, and adults with oral function, airway development, and overall growth. We have gone through extensive training as general restorative dentists to not only help with dental problems, but more importantly, airway-related health and how it relates to the structure of the jaws. We are also fun human beings who love to care for others. So why does airway health matter for your child? And why am I, a dentist, so passionate about it? Well, the roof of the mouth is the floor of the nose. The jaws are important to the airway size. And what happens when we're not breathing well is it can impact our sleep quality. Good quality sleep, it helps brain development. Proper jaw growth, it helps support the facial structure. And finally, unaddressed issues such as small jaw size or low tongue tone, it can lead to other health issues, speech, feeding, or behavioral problems. So what do parents often miss? It's not uncommon in our society for us to look at things that are common and call them normal. Well, I'm here to tell you, snoring is never normal in children. Mouth breathing is never normal in children. Behavioral issues can be linked to poor sleep and oxygen. It's not just your child's attention. So what will you learn today? What causes narrow jaws and airway issues? Symptoms to look for in your child, and what we can do at Untethered to help. So what is airway health? It's ultimately how well your child can breathe through their nose, both day and night. Open nasal breathing equals oxygen-rich sleep because nitric oxide is released from the paranasal sinuses in the nose. When we breathe through our nose, we get better oxygen carrying capacity, better filtration, warming, and humidifying of the air. Blocked airways equals stress, fatigue, and ultimately poor facial growth. So what is nasal breathing versus mouth breathing? Again, nasal breathing warms, filters the air before it enters the lung. It triggers nitric oxide release, which helps the oxygen circulate within the bloodstream. It encourages the tongue to rest on the palate, which drives jaw growth in the right direction. And it helps support facial growth and alignment of teeth. And when we have deeper sleep, we see it go along with better nasal breathing. Well, what is mouth breathing? On the other hand, it's a sign of it's not really dysfunction. It's mouth breathing, on the other hand, it's dysfunction. It is not just habitual. It can dry out the tissues, increasing the acidic environment, leading to bad breath, inflamed gums, and an increase in cavities. How many of you have been told that it's just your child's hygiene and their diet that's causing decay? That acidic environment from mouth breathing is so important to manage if we're going to reduce the decay rate. The tongue is sitting low, contributing to narrower jaws, crowding of the teeth. We get reduced oxygen intake because we're bypassing that nasal filtration and nitric oxide release. And we can see fatigue and brain fog due to this. And over time, we can start to see a change in the child's face and development. So longer face, smaller, tucked back chin, open mouth posture with dry lips. What is proper oral posture? Ask yourself, where is my tongue right now? The tongue should rest on the roof of the mouth. The lips should be closed. We should be breathing through our nose. And the mouth should always be closed at rest, which encourages healthy development. So how does sleep affect jaw and airway health? Children need restful, deep sleep for learning and for growth. This is when human growth hormone is secreted. Airway issues can cause tossing and turning, teeth grinding, snoring or gasping, daytime crankiness or exhaustion, and lower growth curves. So when things go wrong, some of the warning signs: mouth breathing, dark under eye circles from mid-face underdevelopment, restless sleep, all over the place, covers everywhere, snoring or audible loud breathing, crowding of the teeth, no spacing between baby teeth where there should be, and a longer, narrow face and gummy smile. So why is early intervention key? Because they don't grow out of it. They grow into it. Kids are still actively growing. The earlier we intervene, the easier it is to guide the development naturally. Prevention is far, far easier than correction on this continuum of growth. So, true or false? Snoring in children is common and harmless? You guessed it. It is harmful. Mouth breathing can affect a child's face shape? True. Tongue ties only cause problems with breastfeeding? False, and we'll get to why in a little while. Kids naturally will grow out of mouth breathing? False, because the structures dictate the mouth breathing. Restless sleep, bedwetting, dark circles can all be signs of an airway issue? 100% true. Crooked teeth are usually just a dental problem? Heck no, definitely not. All kids with airway issues have obvious symptoms. Absolutely not. Our body's ability to adapt, and also as a society, when we dismiss something that is common and call it normal, such as snoring and open mouth breathing, it means we could miss something that could be quite obvious. Soft foods can impact jaw growth in children? Absolutely true. So what influences how the jaws grow? The tongue, the lips, the cheeks. That pressure from musculature as we're feeding as an infant and a child can drive jaw growth in a favorable or unfavorable direction. Our posture that we sit in, sleep in, breathing, genetics, the environment where we have a lot of allergens and irritants, the food we eat, and the muscles involved with speech. Oral health and airway health are inseparable, you guys. The mouth and the jaw structure directly impact the airway. The roof of the mouth is the floor of the nose. Think about that for a second. Where your teeth are on your upper jaw, that is the base of your nose. If the teeth are crowded or narrow, your nasal cavity is narrow and crowded as well. Proper alignment facilitates better nasal breathing, which is essential for respiratory health. So what does this mean for us? The cycle of oral dysfunction starts in infancy. When we have a low resting tongue posture from low tone or a tongue tie, restricted tongue mobility, that can begin to cause mouth breathing from nasal blockage from reflux or habitual mouth breathing, which will become more of a structural problem. That can lead to this abnormal oral facial growth, which can contribute to narrow jaws and a more limited tongue space. And then we start to see oral myofascial muscle compensations, where the tongue is resting low, the lips and the cheeks are strained, and the cycle of dysfunction continues to perpetuate. So let's talk about tongue ties. There's a lot of controversy out there because everyone says it just impacts breastfeeding. We have bottle feeding, we have formula, but it's so much more than that. The number of children I see with tongue ties that come in who are unable to take a bottle is staggering. Bottles are something that are developed for us to have ease of use and facilitate feeding as much as we can. But the role of a tongue tie goes so far beyond just breastfeeding. So when I hear pediatricians say, we'll see if it impacts speech, we miss a whole host of milestones, including the transition from primitive reflex suck to a more mature suck pattern, from starting solids to crawling and walking. All of these gross motor milestones have to do with the ability for the neck to extend and flex properly, and the tongue tie can also influence that. Genetics. Yes, we have inheritance of smaller jaws, but the epigenetics, how the environment influences our genes, it plays a huge role too. We have environmental irritants, mold, viruses, and a different polluted world than we had years ago. Our bodies are fighting harder than ever for health and stability. So when that nasal cavity is blocked because of mold in a home or irritated polluted air, we could control that as much as possible by modifying the structures and making them broader. So we come to the allergies and environment. That constant stuffy nose can lead to mouth breathing, which can further enlarge the adenoids in the tonsils. And poor air quality indoors or chronic allergies can perpetuate this mouth breathing. And finally, the soft food diet, jaw development. Our diets no longer require intensive mastication of things like nuts, berries, hard meats. We don't have a hard food diet anymore. We have a soft food diet. And with that, we have less jaw stimulation and less bony stimulation of the teeth within the bony housing. And we'll see underdevelopment of the musculature and less development of the bone. This is heavily impacted by the Western diet. In the first generation of introduction of a Western diet into a population, we see a malocclusion in 25%. By the third generation, 75% of individuals will have malocclusion or crowding. We are outpacing genetics here, guys. This is an environmental factor as much as it is a genetic one. And then we start to look at breastfeeding. Breastfeeding, be it a personal choice, it helps support jaw and tongue coordination. That muscle tone shapes the jaw, that drive of the tongue forward, the ability to extend out over the lower jaw ridge and cup the breast tissue and engage the musculature and withdraw the milk. It builds the foundation that our jaws are made of. In our society, shorter breastfeeding is a reality, and that could be because of personal choice, work schedules, busy lives, or tongue-tie, tongue-tone issues. Any breastfeeding aids in jaw development, and there's a correlational relationship between snoring and duration of breastfeeding. Because of the other factors involved, we can't say a child who is breastfed will absolutely not need orthodontics, but it can help support that musculature as well as possible and drive that jaw growth as far as possible so we can reduce how significant these interventions are. So when we look at all these factors combined, there's not a single issue that's causing underdevelopment of the jaws. So don't blame yourselves for genetics. Don't blame the house you live in. Don't blame the fact that you didn't do baby-led weaning. Don't blame the fact that you weren't able to breastfeed. None of these alone in isolation is the problem. All of them together are cumulative, and this is something that really needs to be addressed in all children before we become adults and our jaw growth is essentially complete. So, do any of these apply to your child? Mouth breathing, snoring or grinding, struggling with breast or bottle feeding, delayed or unclear speech, congestion or seasonal allergies, picky eating or gagging on textures due to oral tension, restless sleep or waking up tired or hyperactive, longer face, gummy smile, crowded teeth, has been told they'll definitely need orthodontics because their baby teeth are crowded, or has been diagnosed with ADD, ADHD, or has trouble focusing and sitting still. Because what can narrow jaws lead to? Sleep apnea. Sleep disordered breathing is really a breathing-related sleep disorder. Crowded misaligned teeth, speech and feeding delays, and jaw pain or TMJ because the bones don't line up as well as they should. So what are some signs of airway dysfunction during sleep? Again, teeth grinding, night sweats, mouth breathing, daytime fatigue or tantrum, behavioral issues at school, audible breathing or snoring, and bedwetting past the age of 6 years old. Why is hyperactivity and behavioral concerns related? Because low oxygen and poor sleep equals brain strain. Kids may seem either hyper, aggressive, or unfocused. In our country, we do not require a sleep study before we medicate children with amphetamines to treat ADHD. And yes, as a society, we have higher rates of ADHD than we ever have before because our lifestyles are so different. But how many of those kids could be misdiagnosed because we miss a breathing-related sleep disorder? If we can control the structure and improve on the ability to oxygenate, we can help with behavior. As a side effect, speech and feeding challenges. If there's a lisp or delayed speech, trouble chewing or swallowing, picky eating, could be because the tongue has so much tension underneath it, we're unable to move or mobilize a bolus within our narrow jaw housing. How many of your kids have either spit food out and then put it back in, or they've pocketed food and let it rest there with the saliva to break it down, versus truly masticating and swallowing? Chronic mouth breathing and illness. That mouth breathing, it bypasses the immune filter. We lead to more cold, sore throats, and potential for ear infections because there's not as much engagement with the eustachian tubes as we swallow. A dry mouth equals higher risk of cavities as well. And how can this affect the confidence and the growth of your child? We can start to appreciate that the more mouth breathing we have, the longer and more narrow the face can develop. And we can start to see what's called vertical maxillary excess, or a gummy smile. It's really a down and forward growth of the upper jaw or the maxilla. We can begin to appreciate crowding of the teeth, which is also a sign of narrow nasal passages. And we can start to see lower energy, low self-esteem as children go older. So take a picture of this one, because there's some simple symptoms that you can start to watch for. Again, I've already highlighted that a lot of these things are very common, but they may not be normal. Sure, every kid has little differences from their neighbor. But when we start to see these things cumulatively, we can start to appreciate there may be more than that's just how your kid is, and we can look closer at the structures and how we can help. So what is our holistic approach at Untethered? Our goal is to treat the cause and not just the symptom. We want to see prevention of issues down the road versus waiting for them to happen and then catching up later. We have stress for the structure, the function, and the habits. We work to guide growth as naturally as we can, and we build a care plan that's unique for your child. Depending on the age, we will have consultation and screening, personalized plan, and coordinated treatment, along with ongoing check-ins. Depending on the age, it could mean that we take orthodontic records, where we're able to assess in 3 dimensions, not only your child's teeth with a digital impression, but we can also get imaging that shows us the size of the airway passages when we're upright and awake. We can start to appreciate where the adult teeth are developing and where we may not have space for them. And we can start to look at your child from a whole picture standpoint and see what's possible. One of our main tools that we use is myofunctional therapy. It's basically physical therapy style exercises for the mouth and oral facial muscles. These are skeletal muscles just like any other part of our body. And at times we can pull and do some exercises that we find online. But when it comes to this type of thing, having targeted support to help guide you through, such as a personal trainer, can be really beneficial. Our goal is to get the tongue up, the lips sealed, and the nasal breathing started so that we can keep that jaw growth going in the right direction and maintain stability for a lifetime. We also look at tongue restrictions. The tongue being tied is a very nuanced conversation, and not everybody at all is trained in the same way. A lot of looking at this comes from personal experience and beginning to understand what normal is. Think of it like the webbing in the fingers. If 2 of your fingers were fused together, we would know very quickly that those digits, they're not a life or death condition, but they're limited in their ability to move the way that they were designed for. It's no different than the tongue and the floor of the mouth. As you can see in this image, there's almost a classic heart-shaped tip of the tongue. That's not always that we'll see that, and there are many compensations and factors that we look for that can make a tongue tie that is this obvious appear much less so. So when we think about that webbing of the fingers analogy, we can start to recognize that the tongue can't lift fully back as it is in the second image, that it's restricted in an ability to do what it's supposed to, which is elevate and lift, communicate, breathe, and swallow. And so what is a tongue tie release? We use what's called a CO2 laser, often called a cold laser, and it's a safe, quick, and gentle procedure. We oftentimes, as you can see in this photo, will use some sutures to close everything back up and reapproximate, and we can perform this procedure on infants, children, and adults. In infants, the signs and symptoms we're looking for are far different than that of an older child, because when we have a breastfeeding or bottle feeding infant who's having difficulties with gassiness, fussiness, difficulty latching, maternal vomiting, constant spitting up, Those are the types of things we're looking for in infants. And again, these things are often dismissed as normal when really they're just common, but unfortunately many times are related to the structures. If the tongue isn't elevating, extending, and engaging and creating a great vacuum at the breast or bottle, we will see symptoms develop at some point along the line. That can even come down to slower or loss of breastfeeding earlier than a family desires, because if that baby isn't creating a great suction and latch, we'll see a decline in the ability to create milk, because when we go from hormonally driven to supply and demand at the 3-month mark after delivery, we can start to see that if the baby's not creating a great vacuum, we'll have a dip in supply. So some of these babies fall off the weight curve or slow down the weight curve. They can become frustrated at the breast, or mom can just start to see the milk dry up. And we can often equate that with, oh, I just went back to work, when really it was an issue that's been going on for much longer before that. In children, as you can see here, this is a child. We can go ahead and release those tissues while a child watches a show, uses some nitrous oxide, and is in a relaxing and rewarding environment where they're encouraged that they're going to get some form of a really great prize at the end of treatment. And many of these kids are pretty excited to get this done and get through that process. It can really be a missing piece in long-term function and stability. And what else do we look at? Well, we have to look at jaw size. Anyone over the age of 2, those teeth are in a place where they're kind of locked in. And if we have a jaw that's narrow, an upper jaw, it's kind of like the shoe, and the lower jaw is like the foot. We need the shoe to be slightly larger than the foot so that everything can fit and be harmoniously functioning. Otherwise, we'll have discomfort and symptoms. So early orthodontic expansion can be done as early as 4, but it's oftentimes completed between the age of 5 and 7. We'll intervene earlier if we have children who are not quite candidates for ENT surgery, and ENTs will send them over to expand the oral cavity and volume, widen the nasal floor, and improve upon those breathing processes as early as possible. So when we do our expanders, we take digital impressions, we analyze jaw shape and size, adult teeth shape and size, and we go ahead and start to mock up what could the desired result be to ensure that teeth fit better in the mouth and we have better capacity for breathing through the structures. And most importantly, we work as an interdisciplinary team. Our practice is referral-based mainly, either parents who've had experience with us, families who found us on Instagram or internet, and finally, other providers who refer to us because we have a great collaborative relationship. We work together because none of us can do this alone. None of us can manage all of the aspects of health, and I think that's where medicine got a little skewed. We began to silo things into different pathways. Oh, you need an ENT, and you need a pulmonologist, and you need an internal med. We need to really collaborate and communicate if we want to get optimal results for families. So we work with everyone from functional therapists to manual therapists, traditional medicine doctors, functional medicine doctors. Our goal is to help your family achieve the goals that they need of getting better health for their family. So when should you reach out to us? Take a picture of this one and evaluate, is this something that resonates with me or my children? And give us a call. We're happy to help. So what do we cover today? What causes some airway and jaw issues? Symptoms you can look for, how we can help you, and what you can do next. Thank you so much for taking the time to watch this. I'm really excited about the future of airway health and dentistry. I'm really excited about the opportunities that we have for our children. What I tell all families is we're just trying to do better for our kids than our parents were able to do for us. We have more information now, more technology at our fingertips, and more communication amongst families. I'm so optimistic for the next generation of adults as they keep progressing through this growth continuum. I do feel strongly that intervention is necessary. We need to breathe as well as we possibly can. And the great thing about dentistry is we have access to those structures through the dental care we render.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
Want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @Untethered Airway.
Until next time, bye!